should Ontario close its borders to Albertans? That province has seen COVID-19 cases trending upward as it controversially lifts a number of public health measures relating to quarantine, isolation, and masks. Now, that decision has led to dozens of experts criticizing the Alberta government, and some here in the GTA even canceling their trips to the province. Starting today in Alberta, those coming into contact with a positive COVID-19 case will no longer be mandated to quarantine. Then on August 16th, isolation for people who test positive will be recommended instead of mandated. And the mask mandate will also be lifting mid-month, no longer required in places like taxis, ride shares, and public transit.
It's almost like a free-for-all, like they're just letting COVID rip through Alberta, and I can't take that risk.
The fully vaccinated Lehman family, parents and 2 teens living in the GTA, were supposed to head to Alberta next month, but have since canceled their trip.
It's just too risky. I don't understand why the government would do that. And for us, it's disappointing because this was our first big post-quarantine trip. And so we have a lot of disappointed folks here at home. And I have family in Edmonton.
Alberta is defending this shift, saying it's based on data and vaccination rates, but some experts say it's putting vulnerable people at risk.
This just seems like a cruel experiment that is being imposed at a public policy level that is not in line with the science, but more seemingly, wanting to pander to some politicization of the pandemic.
The decision has garnered criticism from dozens of experts, many of which have also pointed out that Alberta is one of the only places in the world that's removing some of these critical public health measures.
It's one of the most egregious policy disconnects I've ever seen in the country when it comes to what we're still trying to manage in a pandemic and what we're still trying to protect and save people's lives through a global pandemic.
CityNews reached out to Ontario's Ministry of Health this morning to ask about whether or not Ontarians should travel to Alberta and vice versa amidst these growing concerns for public health measures. But we received no response to our emails in time for broadcast.
This is a global pandemic. We need to ensure that there is communication between provinces when it comes to travel decisions so that people and families can be fully informed to make those choices. And I think when we're not seeing that take place, we're not seeing the coordination take place, it puts people more at risk and it erodes any confidence around the type of travel that, people are really looking to have.
An expert in biomedical engineering and immunology who used to make mRNA vaccines says pay attention to what's happening regionally. Expect to see flare-ups in some places.
Inconsistencies across populations around the country are really going to show up. So if we have a low vaccine uptake in certain regions, we may see higher cases of Delta, for example.
Experts say vaccines will help in preventing deaths and hospitalizations, an important measure, particularly with the spread of the Delta variant. Another factor these experts say needs to be considered, the return to school, just around the corner.
Children under 12 who just cannot be vaccinated. There's no vaccine that's been licensed for their use. So they are vulnerable, they can get infected. Chances are they'll probably be asymptomatic, hopefully, but that doesn't mean that they are still incapable of transmitting.
Now, in addition to Ontario's ministry, we also reached out to Health Canada about the recent changes in public health measures in Alberta and questions around out-of-province travel. We're still waiting to hear back. Meanwhile, earlier this month, Saskatchewan also removed all public health orders, including mandatory masking as well as capacity limits.